Hello, I am Dr. Rishikesh Behere. In today's video, we'll understand one of the controversial scientific debates currently facing prenatal care, that is the potential link between the most common counter-analgesic acetaminophen or Tylenol and the risk of neurodevelopmental disorders, specifically ADHD and Autism Spectrum Disorders. For decades, acetaminophen or paracetamol has been accepted as a safe choice. Alternatives like NSAIDs have established fetal risks, and hence acetaminophen or paracetamol is used as a default. However, this has been challenged by certain statements made recently which are not backed by substantiated evidence and is leading to confusion. So these systematic reviews utilizing the navigation guide methodology have identified various observational studies which show a statistically significant link between the timing and duration of acetaminophen exposure during pregnancy and a later diagnosis of ADHD or Autism Spectrum Disorders. This is not a finding that can be easily dismissed. However, the core critique is that when a mother takes acetaminophen for chronic pain or fever, the study must account for the biological impact of the pain or fever on the fetus. This is also called as reverse causality. If the researchers fail to control this and also various unmeasured factors which are called as confounders, the drug is then blamed as being a causative factor. To control for confounding, a sibling control design is a gold standard. Here, by using siblings, we eliminate the vast majority of shared background risk factors. The Swedish study used this methodology on a large cohort to re-examine the perceived risks. The results showed that in the sibling controlled analysis, the risk ratios for the neurodevelopmental disorders was very close to 1, which suggests that there is a negligible risk. Hence, the sibling studies support a strong effect of confounding which has been observed in the various observational studies. However, the FDA has acted on a precautionary basis by initiating label warnings. However, they have also clearly stated that the causation is not proven and the clinicians must weigh the unproven risk against the known severe risk of conditions such as persistent high fever or severe pain. Hence, it's important that we assure patients that there is no causation that has been established. At the same time, there are a number of confounding factors which have not been accounted for in these studies. And the drug remains a preferred option over alternatives like ibuprofen or aspirin or other NSAIDs, and paracetamol acetaminophen continues to be safe. Hence, the goal should be careful risk management and not absolute avoidance. And as clinicians, it is important for us to take note of the various limitations that observational studies can bring about, and we should understand the role of confounding factors and reverse causality while appreciating the scientific literature. Thank you.
Subscribe to tipsexcel.com for latest psychiatry clinical updates.